Syncope. It means fainting or passing out. Syncope is common. It occurs when you feel perfectly normal 1 minute and then you suddenly pass out. When you wake up, you're back to normal, but then you may pass out again. This is common and you don't have to worry about it. Syncope occurs because the normal rate of blood flow to the brain slows down. This can occur for any of the following reasons. If you've been injured, if you're under stress, if you're in a lot of pain, perhaps while you're using the bathroom, or if you're coughing a lot. All of these can cause a significant drop in blood flow to the brain. If you stand up quickly, or if you've been sitting for a really long time and then you stand up, your blood pressure can plummet, and that would cause fainting. Your blood pressure may go down because the heartbeat is too fast or too slow. There could be a problem with one of your heart valves. Blood circulating in your body can't enter the heart if the valve doesn't open and close correctly. Another reason for syncope is dehydration, and you might need to drink more fluids. Medications you take may cause some problems and make you faint. Drinking a lot of alcohol can cause fainting. If you cut yourself and lose a lot of blood, you might faint. There may be some problem in your body somewhere. And even after the doctor examines you, sometimes they don't know the reason. The doctor will examine you and try to figure out what's causing you to faint. The doctor will take your blood pressure, and listen to your heart using a stethoscope to hear if the beat is too slow or too fast. The doctor may decide to do an EKG test to provide a graph of your heartbeat pattern. This is done by placing electrodes on various places in your body, and these send signals to the EKG machine. The picture will tell the doctor if there's a problem with your heart. Ultrasound imaging, which you may know from seeing images of babies before they're born, can also be used to see what your heart looks like. You may be released to go home after your examination, or you may be asked to stay for observation. You may be given a heart monitor to wear for a couple of days. With a heart monitor, you go on with your normal life and activities, and you don't change how you live while you wear it. If you have any strange feelings from your heart, you will write it down. You'll write down the time that it happened and the date and what you were doing just before you felt that sensation. You will keep this log for a few days, and then for the next appointment with the doctor, you'll give back the monitor with the notes that you took. The doctor will read your log and then see on the picture of your heartbeat if there was any unusual activity at the same time. This may help the doctor figure out how to help you with your syncope episodes. If you had syncope happen to you, the doctor will give you a list of suggestions if they found a reason for your fainting. They will advise you to avoid that activity. Maybe you are not drinking enough fluid and you need to increase the amount of water that you drink. If the doctor says your medication is causing the problem, you'll be told to stop taking it. If the problem is inside of the heart, you may need surgery for a pacemaker to be placed inside. This will stimulate the heart to make sure the beat is normal. If you have had syncope and fainted, here are things you can do to prevent it. It's important to sit with your feet elevated above your waist or chest. Also, if you faint, try to remember what you did right before you fainted, step by step, to find the reasons. If you have the answer, avoid doing that activity so you don't pass out again. Go back to the ER if you keep having syncope episodes many times. Sometimes you can lose consciousness from other problems. Like headaches or seizures, which can look a lot like syncope, chest pain, back pain, rapid breathing or irregular breathing, abdominal pain, or a woman who might be pregnant and might not know it yet. Any of these, if they occur, mean you should go back to the ER.